We are going start fourth lesson medical emergency and contrast media. Temperature, pulse, respirations, and blood pressure is the vital sign. Normal body temperature: oral 98.6 farad, rectal 99.1 farad to 99.6 farad, axillary 97.6 to 98.1 farad, infant to age 4 99 farad to 97 farad, and child age 5 to 30 97.8 farad to 98.6 farad. The common pulse point the common pulse point are radial, carotid, temporal, femoral, popliteal. Normal pulse rate: men 70 to 72, women 78 to 70 82, children 90 to 100, infant 120. Needle gauge: identify diameter of the needle bore, and large gauge small bore diameter, small gauge larger bore diameter. How part of needle attached to the syringe or IV tube. Medical equipment that could contain latex: disposable gloves, tourniquet, blood pressure cuff, stethoscope, intravenous tubing, oral and nasal airway, enema tube, endorectal tube, syringe, electrodes, pad, catheter, wound drain, injection port. Type of the reactions: latex, irritant, contact dermatitis, allergic, contact dermatitis, delayed or hypersensitivity. Latex allergy: immediately hypersensitivity. Next is summary. Opening vital sign involving the measure of the body temperatures, pulse rate, respiratory rates, and arterial blood pressure. Symptom of inadequate oxygen supply include dyspnea, cyanosis, diaphoresis, and the neck pain. The distension, seated, and semi-folded positions are helpful for the dyspnea patient. Oxygen is usually available through wall outlet with adjustable flow meter or in tank, having flow regulations valve, and the indicator involving quantity of oxygen left in tank. Oxygen can be administered by the nasal cannula, mask, or me. Medical ventilator oxygen support the combination, so it must be used always from flame. The suction device are used for the aspirations or the secretion. Suctions is available from wall outlet or port suction machines. Suction device use the aspiration suctions available from the wall outlet portable machines. Needle size indicate that by the gauge larger gauge smaller needle bore. The butterfly set or IV catheter are generally used for the IV injections. Contrast media are the and cubital veins generally used injection contrast media. The heparin lock may vein accessible for medication administration at a frequent interval. IV solutions should be evaluated 18 to 24 inches above the injection site. Chest tube chest tubes function to remove fluid from the thoracic cavity. The NG and NI tube assist the removal of gastric secretion or urine and or used for the administration of wall soluble contrast material. The urinary collection bag must be kept below the level of the bladder to prevent UTI catheterization. Procedure must be sterile. The radiographer must be alert for any sudden changes in patient conditions. An allergic is an abnormal acquired immune response. Allergy can be introduced. Allergens can be introduced into the body by the correct ingestion, inhalation, or injection. Initializations to allergic require subsequently contact result and inflammatory response. Protein in latex can be produce mild or severe allergic reaction. Type of reaction to latex irritant contact and late immediate hypertensive. Next is oral administration. PO by mouth through the digestive system. Perinatal, topical, subcutaneous, intradermal, intramuscular, interventional, intrathecal. Contrast media positive, radiopaque, barium sulfide, iodinated, negative, radiolucent air. Other cases. Subsequence and the combination contrast examination. Sequence IV, GV, BE, and GI. IVU, GB, BE, and GI. Examination that can be combined GB and IVP, IBP and BE, GB and GI. GB iodinated contrast evening before examination, water only in AM, and PO after midnight UZI. B catheter cleansing enema. IPU and PO after midnight cleaning enema, empty bladder before the Scott film. The qualities of the iodinated contrast agent that they contribute the discomfort, side effect, and the reactions. Velocity, more viscid, thick, sticky agents are more difficult to inject and they produce more heat and vessel irritations, and the higher the concentration and greater the velocity. Velocity also increase the room temperature, decrease toxicity. Potential toxicity is the greater and higher concentration agent and ionic agent. Miscibility. Contrast agents should be ready miscible, able to mix with the blood. Osmolality. low stimulating agent have fewer particles in a given amount. Solutions are less likely to produce allergic reaction. Inject or absorption. The sensitizing agent reaction can be result from summary. Multiple radiological examination must be scheduled in a sequence that allow to prompt the adequate visualizations of the structure of interest. The patient must be appropriately prepared for the contrast examination. Administration for examination for which they are still drug and medical may be administered as orally or parenterally. Patient administration include the topical, oral, subcutaneous, intradermal, IV, IM, and the intrathecal. The artificial contrast media functions in increasing insufficiently subinject contrast. Artificially contrast media can be positive, radiopaque or negative radiation. Positive contrast media include the barium sulfate or the iodinated oil or water-based agent. Quantity or the iodinated contrast media that contribute to their risk include the velocity, toxicity, and the miscibility. Negative and positive contrast agents are often used together or double contrast. Study water soluble obsolable contrast agents are used to replace the barium sulfate when the visceral perforations is suspected. Patient required to clear complete the post-procedural instructions, particularly following barium anemia examination. Non-ionic iodinated contrast agent produce far fewer side effects than do their ionic counterparts. Non-ionic contrast agent more expensive. Reaction to ionic agent usually occur within 2 to 10 minutes following injection. The symptoms of the mild reaction include the mild urticaria, flushing, nausea, nasal congestion, metallic taste, and the antihistamine is the usual given to the patient. Next summary. It is essential that radiographer be alert for any sudden change in the patient condition. How well radiographer recognize and are prepared to meet challenges in the emergency situation can be largely determine the outcome of the emergency. Now question answer of this chapter. Now question answer. First question: which of the following is our symptom that inadequate oxygen supply? Diaphoresis, cyanosis, and dyspnea. So all three is answer. Answer is D. Next question is the usual patient preparation for an GI examination. For GI examination and PO, 8 hours before the examination. This is the answer. Before the performing which of the following examination is catheteric almost always required? The answer is lower GI. And which of the following gaze needles has large bore? The answer here is the 12. And next, the proper treatment for the contrast extravagances into tissue around a vein include. The answer is second and third. The application of moist heat onto affected area and application of pressure to injection site. Next is parental administration of drug may be performed. Parental administration of drug may be performed. This is intrathecally and intravenously, means accept the oral. Parenteral means accept the oral. Next question is which is the most frequently used site intravenous injection contrast media? This is the anticubital. Next, in what order should the following examination be performed? The answer is first we will do IBP, then we will do enema, then upper GI. The answer is D231. The next question is a patient IV bottle or bag should be hung this 18 to 24 inch above to vein. Next question is the patient is feeling of spinning or the room spinning around him is called vertigo. Thank you so much.